We have Michael D. Fox here. Welcome.
Thank you, Andreas.
Do you ever get confused with some other Michael Fox?
Unfortunately, that happens almost every day.
Oh, okay. So tell us what you do.
I'm a reproductive endocrinologist in Jacksonville, Florida. We offer in vitro fertilization, fertility services, and take care of a lot of surgical patients as well.
Okay, now you're on the low-carb cruise to the Bahamas. How did you end up here?
Well, we have a special interest in polycystic ovarian disease as an ovulation disorder, and about 5 years ago we got really interested in the insulin aspects of this disease and started treating it more in a metabolic fashion.
Yeah, and what kind of fashion is that?
We really came to our own conclusions about low carbohydrate as the best way to treat it. As we slowly refined our approach, our results got better and better in terms of pregnancy rates, weight loss, and all the things that go along with that.
Good. So what kind of results did you get before and after? What kind of difference did you see?
Before we started a metabolic approach, we had about 40 to 50% pregnancy rates using, say, oral and relatively less aggressive ovulation treatments. Many of the patients that did not get pregnant went on to require in vitro fertilization. Now, after we have instituted a fairly aggressive approach, we have very few patients that go to in vitro fertilization.
So most women get pregnant using just a diet.
That's correct.
More or less treatment.
Go ahead.
Yeah, I was just thinking maybe you should describe what is this polycystic ovary syndrome for a layman. What kind of problem is that?
Basically, it's a hormone imbalance. That traditionally seen from a gynecology perspective is the overproduction of male hormones by a woman. So they have symptoms: facial hair, acne, oily skin, and then the menstrual cycle is not regular, which causes the fertility problem.
Yeah, so okay, and they also have like often obesity problems or overweight issues.
Most patients do, although there is a group that's called lean PCO, which has a more normal weight.
Okay, so how common is PCO, this hormonal imbalance, in your estimation in the U.S. population?
My guess would be it's probably present in 25 to 30% of people. I think the textbook answer is maybe 8 to 10%. And of the patients we see for fertility problems, probably at least 40 to 50% have some component of PCO.
Wow, about half, huh?
Right.
That's a lot then.
Very, very large numbers.
Okay, but you're interested in other aspects of carbohydrate restriction as well, not only for this hormonal imbalance, but also for other diseases. Will you tell us a little bit about that?
We see patients now just because we're very interested in the insulin resistance issue, and there's not great access to services in our area. We see patients with type 2 diabetes. We see patients that come for a routine exam that are overweight. We tend to test those patients. They have hypertension. So essentially the metabolic syndrome, we will evaluate people for that.
Yeah, and you eat, you don't eat that much carbohydrate yourself, or?
No, I put myself on the low-carb diet 5 years ago, and gradually, over a couple of years, worked my way down to almost no carbs.
Really, almost no. So what kind of effects did you see on yourself?
I had about a 16-pound weight loss. I have great energy all the time. I sleep well and feel stronger at age 50 than I did at 35.
Yeah, you're pretty slim for someone 50 years old. I want to show you. Well, no weight problems. to be seen. That's nice. Yeah. What kind of message do you have to people that might be having some kind of menstrual problems and problems getting pregnant? What should they do?
We definitely believe that the fertility diet, so to speak, is a low-carb diet. We really encourage our patients to try to get down to 0 carbs. So something similar to the Atkins diet would be the way to go.
What kind of food would you recommend for that?
We recommend mostly like 50% calories from protein, 50% calories from fat, and so vegetables, meats, seafood type foods, and then the really saturated fats such as butter, heavy cream, olive oil, things like that.
So should you worry about saturated fat, do you think?
We definitely think saturated fat is probably the best fat for humans.
Oh, that sounds good. It's tasty too, right?
It tastes great. We love butter and we encourage all that.
Wow, that's nice.
In fact, I say to my patients, I want you to consciously add fat to each meal.
All right. So this is kind of controversial everywhere, I guess, but maybe even more so in the US, where people have been saying for a long time that saturated fat is bad for you. So do you kind of get any reactions from your colleagues or other people, dietitians, or what do they say? Do they think you're crazy?
Well, pretty much. The patients generally look at us like we're a little bit crazy. Our society definitely has been completely brainwashed against saturated fats.
Yeah. So what do your colleagues say?
Our colleagues are starting to actually be curious because our patients do so well. The dietitian world is still very, very resistant to any sort of low carbohydrate approach.
Yeah. Do you have any colleagues that you're working with that are using the same approach regarding carbohydrates and fat?
Not in our area. My partner also has subscribed to our approach after he joined our practice.
So there's 2 of you at least.
Right, and then we have 3 nurse practitioners that work with patients too. So.
And they see the results and.
Right.
Yeah. So there's 5 of you spreading the message.
Right. It's well, we do feel like we're sort of out there by ourselves pushing this idea.
Yeah, but I mean the results speak for themselves with lots more pregnancies, and it's good. Thanks a lot for allowing me to interview you.
All right, well you're welcome. Thank you.